Hi everybody, it's Professor Kat. Let's start answering some of your COVID questions. If you're going for a run on campus or exercising outside, you should always have a mask available. If you're completely by yourself and there's no one nearby, you can let your mask down, but as soon as you're close to someone, if you pass someone on the street, if there's someone coming towards you, pull up your mask just as a courtesy. Eventually, yes, the university will be able to reopen at full capacity. It's just going to depend on how quickly the vaccine becomes available and people become vaccinated in the local community. It's not enough just to have a vaccine approved, but people need to actually be taking that vaccine at a high enough level to reduce the spread of the virus in the community. If the travel quarantine order is still in place in Santa Clara County when the dorms reopen, then yes, students will quarantine for 14 days in their dorm room once those residence halls reopen. Priority for the vaccine will be based on how we can protect the most people and protect the most vulnerable. So in California, we'll be starting by vaccinating people who work in healthcare settings in any capacity, not just doctors and nurses, but all of the staff at those healthcare facilities who may be exposed at work. And similarly, all of the people who work in long-term care settings like skilled nursing facilities or nursing homes. In that way, we'll start to have the biggest impact, and then as more doses become available, we can sort of scale up to the larger population. Updates about winter quarter are coming. We have to be responsive to state and local health orders, and right now the stay-at-home order for Santa Clara County is in place until January 4th. And the reason those state and local restrictions are in place is because hospitals are reaching capacity. Right now in Santa Clara County, only 10% of ICU beds are still available, and those are for not only COVID patients, but also people who may come in with heart attacks or after car accidents. It's really hospital availability that's driving these restrictions, and we need to be responsive to that. Exposure notifications are now available on your smartphone. As of December 10th, it's up and running in California, and if you go to settings and turn on exposure notifications, it takes about 20 seconds, you can be alerted if you are in the vicinity of someone who tested positive for COVID. It's another form of contact tracing, it's completely anonymous, and it works best if more people use it, so check it out. We'll be taking a break over the holidays and we'll be back in January. In the meantime, you can visit our website and check out the old Instagram stories, ask questions there, and as always, stay safe, take care of each other, and we'll see you in January.